Hello and welcome to today's video. In this lesson, we will explore obesity, a major public health concern that's growing rapidly around the world. Obesity affects people of all ages and backgrounds and increases the risk of several serious and chronic illnesses. From causes and symptoms to treatment and prevention, this video will guide you through everything you need to know about obesity in a simple and expert way. Let's begin with a basic definition. Obesity is a condition where excess body fat has accumulated to such an extent that it can negatively impact a person's health. It is more than just being overweight. Health professionals use a measurement called body mass index or BMI to classify obesity. Here is how it's broken down. A normal BMI ranges from 18.5 to 24.9. Overweight is between 25 and 29.9. Obesity class 1 is 30 to 34.9. Class 2 is from 35 to 39.9. And class 3, also called morbid obesity, is a BMI of 40 or higher. Now, let's talk about global trends. According to the World Health Organization, obesity has nearly tripled worldwide since 1975. Today, more than 1.9 billion adults are overweight, and over 650 million of them are obese. Childhood obesity is also on the rise, especially in urban areas, largely due to unhealthy diets and lack of physical activity. But what actually causes obesity? It often results from a simple imbalance, eating more calories than the body burns. But it is not just about food. There are several contributing factors like genetics and family history, sedentary lifestyle, high calorie, nutrient poor diets, endocrine disorders like hypothyroidism and polycystic ovarian syndrome, commonly known as PCOS, certain medications like corticosteroids or antidepressants, emotional or stress related eating. On a deeper level, obesity changes how the body works. Fat tissues is not just storage, it acts like an endocrine organ, releasing hormones and inflammatory substances. These can lead to insulin resistance, a condition that increases the risk for type 2 diabetes and other metabolic disorders. It also disrupts the balance of important hormones that control hunger and fullness, such as leptin and ghrelin. This makes it even harder to manage weight, creating a vicious cycle. Next, let's go over some signs and symptoms. People with obesity may experience noticeable weight gain, tiredness and low energy, joint or back pain, difficulty sleeping or obstructive sleep apnea, skin changes like stretch marks or acanthosis nigricans, a darkening of skin folds. But the real concern lies in complications. Obesity raises the risk for many diseases, including type 2 diabetes mellitus, heart disease and stroke, high blood pressure, non alcoholic fatty liver disease, osteoarthritis, infertility and menstrual issues, certain cancers like breast and colon, mental health issues such as depression and anxiety. So, how is obesity diagnosed? As mentioned earlier, BMI is the main tool used, but doctors may also assess waist circumference to estimate abdominal fat, waist to hip ratio for cardiovascular risk, blood tests to measure cholesterol, blood sugar, and liver function, imaging studies like an ultrasound if liver disease is suspected. Once diagnosed, obesity management starts with a plan. It is a long-term condition and requires a combination of approaches, including diet, physical activity, behavioral support, medications, and in some cases surgery. The goal is to lose about 5 to 10% of the body weight, which can significantly improve health. Let's first talk about diet. A healthy, calorie restricted diet is essential. Eat more whole foods, vegetables, fruits, lean proteins, and whole grains. Reduce sugary drinks, fast foods, and processed items. Practice portion control and mindful eating. Some may benefit from medically guided diets like intermittent fasting or ketogenic plans. Next is physical activity. Exercise helps burn calories and improve metabolism. Aim for at least 150 minutes of moderate activity weekly. Combine aerobic workouts with strength training. Simple activities like walking, cycling, and climbing stairs are effective. Equally important is psychological support. Cognitive behavioral therapy or CBT helps patients understand their eating patterns, build self esteem, and stay motivated. Family counseling and support groups also play a huge role. Managing stress and ensuring good sleep are essential too. If lifestyle changes don't work alone, doctors may prescribe medications. Orlistat reduces fat absorption from the gut. Liraglutide and semaglutide are injectable drugs that reduce appetite. These should always be used under medical supervision, as they may cause side effects and are not suitable for everyone. Now, let's discuss surgical options. Bariatric surgery is considered when BMI is 40 or more, or when BMI is 35 and above, with obesity related health problems. Common procedures include gastric bypass, sleeve gastrectomy, and adjustable gastric band. These surgeries change the stomach size and how food is absorbed. They are effective but not a quick fix. Patients must commit to permanent lifestyle changes and long term follow up. Prevention is always better than cure. Obesity can be prevented by promoting healthy habits early in life. Encourage home cooked, nutritious meals. Limit junk food and sugary beverages. Promote physical activity in schools and homes. Reduce screen time. Educate parents and children about healthy choices. Let's not forget the impact of obesity in special populations. In children, it increases the risk of lifelong health issues. In pregnant women, it raises the chances of gestational diabetes and delivery complications. Older adults may struggle with mobility, further worsening the conditions. Socioeconomic and cultural factors also influence the obesity epidemic. In many low income settings, access to healthy foods and safe places to exercise is limited. At a public health level, obesity strains healthcare systems and reduces productivity. People with obesity may face stigma, discrimination, and mental health challenges. Solving this requires not just individual effort but support from governments, schools, workplaces, and the food industry. To wrap up, obesity is more than just a cosmetic issue. It is a chronic, multifactorial disease that affects physical, emotional, and social well being. It needs compassion, education, and long term commitment. Treating and preventing obesity improves quality of life and reduces the risk of many chronic diseases. That's it for today. Thank you for watching this video. If you found it helpful, please like, share, and subscribe for more medically accurate and easy to understand content. Stay healthy, stay informed. I will see you in the next lesson.